Welcome to Health Links Aging Strong. It is Tufts Medical Center's injury prevention and outreach program that is really passionate about sharing information and resources that can help the older adults live a life that is safe, healthy, and happy. So today we have Lee from Rivers of Hope. But before I introduce Lee, I do want to thank the Quincy Health Department for continuing to sponsor this program. I want to share with you a speaker. She is a nurse and works for Rivers of Hope. And the topic that she'll be talking about today is services for the older populations. These people, not just actually older populations, but people with disabilities, how they could live safely in their own homes. And according to the National Institute of Aging, a lot more older adults are choosing to age in place. I'm really excited about the topic that you'll be talking about today, services available for seniors choosing to live at home, because I am a daughter of aging parents. And what you're going to be talking about is something that I will be listening to both professionally and also personally. So I can't wait to learn from what you have to share with us today.
As Debbie said, my name is Omalea Lauren-Fumi, but everybody calls me Lee. I am so excited to be doing this today because there are a lot of services out there that are available for seniors choosing to stay at home that most people don't know about. So they tend not to have access to these things. So I'm just very excited to do this today. So I'm going to start with the basic terminologies, just because I'll be saying a few words as I go throughout the whole presentation. So we kind of start at the same place. So aging in place is when an older adult chooses to stay at home instead of going into a care facility. So choosing to stay in the home you've been living in for the past 30 years where you're completely comfortable at, rather than moving to assisted living or a nursing home. A caregiver is a person who is providing care to someone in the comfort of their own home. So a caregiver could be a professional or a family member or a friend who's choosing to live with you and just help you with your day-to-day activities. So Medicare is federal insurance for people 65 years or older, or some people under 65 with certain disabilities and conditions that makes them need certain services. While Medicaid is a joint federal and state program that helps people cover medical costs with limited income or resources. ADLs. Activities of daily living are things that include bathing, ambulation or walking, getting dressed in the morning, eating, transferring, toileting, while IADLs, which are instrumental activities of daily living, include things like managing your finances, transportation to appointments, or just going grocery shopping, shopping on its own, meal preparations, ordinary housework, cleaning, managing communication using cell phones, being able to send emails, and managing medications. So there are several reasons why a person would want to age in place. Comfort. You're used to being in your own home, in your own space. It fosters independence. Being in your own place, you know where certain things are. You don't have to learn a new process of doing things. It encourages engagement with the community because you're used to this community. Your friend is living down the street. It helps you want to get up and, oh, my friend's down there. I could go hang out with her for a few. And that also fosters you being able to independently do certain ADLs. Affordability. It is way cheaper to continue to live in your home rather than moving to a care facility. And also it slows down memory decline, because we all have those routines that we go through on a daily basis, and being able to stick to that routine really helps to prevent memory decline. So there's two things that people tend to confuse: home care services and home health care services. So home care services involves non-medical services that provides companionship and assistance with activities of daily living and IADLs. While home care services involved bringing in a medically trained or a medically skilled person to come into the home to provide services that require a written order from a licensed professional, licensed medical professional like an MP or a PCP. Little known fact, insurance companies actually prefers for you to age in place because it is more cost effective for them to send one person into the home rather than you going to a care facility where they have to pay the facility thousands of dollars rather than them paying one person to come into your home for a few hours per day to provide those services that are being provided at a care facility. And the past couple of years, especially since COVID really came in, they've been making sure that they're like making availability for more services to be able to be provided in the home, especially when you need extra help with ADLs and IADLs. And extra help can go from just supervising day-to-day activities to actually providing physical assistance with these activities. So there are a few insurance-funded home care and home health care services that are available. And for home care services, you have companion care. That is when someone comes into your home and just provides companionship when you live alone. They could read you a book, help you with like chores or personal care where they come in and can help you with showers or brushing your teeth and things like that. Chore services, they will come in, help you with grocery shopping, cleaning the home and things like that. Medication assistance, they can help you set up your medication box or come in at medication times. If you take medications AM and PM, they will come in during that time and help you take your medications. Or if it's 3 times a day, whatever the number of times, just because sometimes there's some memory decline and you're not able to like tell when you have to take the medications or you need to be reminded to take those medications. So someone would come in and help during those times. Respite care is someone coming in and providing care, but it's not skilled services. It's just helping with the little ADLs. Homemaker is someone who would come in and help you clean. And sometimes some of these services like interweaving to each other, but it's just available. So in case you need more, in case you need less, and then non-emergent transportation is providing transportation to medical appointments, like day programs. If you do go to day program, day hubs and things like that. Wow. Home health care services include like I said, medically skilled services like wound care, adult foster care, if you're getting IV or nutrition therapy, monitoring or maintaining serious illnesses, like coming in, a nurse coming into the home to give insulin or check blood pressure a couple of times a week because you have a history of hypertension and it's being monitored by your PCP. Coming into the home to do physical therapy, occupational therapy, speech pathology, or having a home health aide for certain hours per day, or a CNA, or an LPN, or a registered nurse coming to the home for specific hours per day. Most of the services are available through, all of the services are available through insurance, but there are also private pay options. Because through insurance, you can only get like for basic needs. Sometimes you need a little extra or the family feels like you need a little extra. So there's private pay home care options where you pay out of pocket. It allows the family or the individual to hire a professional to come into the home and provide the needed care or extra needed care because you could have services through insurance and also have private pay as well. A good example I always use is you have a nurse during the day and you have like private pay for during the night for when they have to get up to go use the bathroom and you feel like they can't get up on their own. They can't safely get into the bathroom by themselves during the night. So having someone come in during the night can be an option for private pay. So non-insurance related options. I found this, I looked into this because sometimes you don't have those, your insurance doesn't cover a lot of things. So I found this and I was like, this is really interesting. You can, if you live in a small town, you can offer room and board in exchange for home care assistance. This is after I always mention, like, do a background check, make sure the person, you can actually live together with this person, because, you know, inviting someone into your home that you don't know so well, you have to make sure that it's safe and they're actually willing to help you with the things that you're offering them home and board for. Cost sharing or splitting hours of caregivers with other neighbors or relatives. So you have a nurse coming in the morning, or you have a home health aide coming in the morning, and then the family comes in during the evenings to kind of be with you, so you're not alone in case your insurance doesn't cover companionship and things like that. So that way you're not completely alone. Just having someone there with you sometimes, and digging through corporate insurance, corporate retiree benefits beyond just pension. There are often like additional services for in-home care. So if you look through, sometimes you find things that you don't know things are there unless you're actually looking for them. So if you look through some policies that you might have, you might see that there's an option for home care services, and you can use those without having to pay for those. Also looking for benefits that are available based on your previous job or public service employment, like through the VA. The VA has a lot of options for people choosing to live at home. And if you don't look into those things, talk to people, you would not know they're available. The Aging Services Access Point is a private nonprofit agency with governing boards that serve and represent 55% of people age 60 or older. They provide direct and protective services, information and referral, reassessment of need, interdisciplinary case, and more. This is one of the things that I found during my research. They are available in most places. You just have to find a location that is close to you. Going to the disability website, you can find free services or some insurance-funded services that will come into your home and help with your ADLs and IADLs, and looking through your long-term insurance and life insurance policies for benefits that you might be entitled to. The hardest and the most obvious option is asking for help. Just calling someone, just picking up the phone and calling someone and asking for help. It's so simple, but it's so hard sometimes for some people to just ask for help. And that's the first step to take if you don't know what to do. And sometimes it might take a while for you to get help, but just trying and moving towards like, okay, this is what I might need. I don't know exactly what I need, but let me pick up the phone or see if I know a friend who knows something. Several calls later, you might find exactly what you need, or it might just take you one call to find what you need, but you will never know if you don't ask for help. Many older adults want to age in place and stay in their own homes as they get older, but may have concerns about safety, getting around, performing basic daily activities independently. And by making a few changes to your home, you can make it safer to live independently for as long as possible. Tips for keeping the home safe. Don't use an area rug. These are things that can crumple up and lead to a fall. Check to make sure the carpet is fixed to the floor to prevent falls, because if you do live alone, if you fall and you don't have any assistance, it might take a while to get help there, or nobody might know you have fallen. So it's good to have all these things checked off. Replacing the handles on the door or faucets with ones that are comfortable to use, things you can easily grab onto, makes the home a lot safer. Having grab bars near the toilet, in the tub, in the shower. And I always say, like, if you can get a shower chair, get a shower chair. It makes it so much easier to sit, so you don't have to rush through taking a shower, makes things go smoother. Reducing fall hazards by placing non-slip strips or non-skid mats on the tile or wood floors or surfaces that may get wet. These are simple, easy things that you can do to your home that can help and help you continue to live at home safely. Also placing light switches at the top or bottom of the stairs, and remember to turn on the night lights, just making sure that the hallways are well lit. And if it's possible, just if you can move your bedroom downstairs so you don't have to go up and down the stairs during the night, makes it even much better and safer for everybody. Installing a ramp with a handrail in the front door, because getting up that stairs sometimes when you have arthritis or you're just feeling that back pain, having something to hold on to and being able to take your time to get up that 4 flights of stairs is everything sometimes. And remembering to weatherproof. Falls are insane during this time because it's getting icy, it can get slippery, and falls can lead to a whole other things. Here's my contact information. If you have any questions or you need help finding services, my cell phone is there. You can give me a call. I'm always happy to help. Even if I might not have the right answer, but I'm willing to call around to make sure you find the right services, because if you don't, you find someone, I love the idea of being able to help someone, at the end of a phone call, being able to provide an option for someone. That's everything. Any questions?
Well, you covered so much. I really appreciate your presentation. And you know what? First of all, thank you so much for talking about the basic terminologies, because working in the healthcare system, we love abbreviations and we just rattle it off and we think everybody understands what ADL is and ASAPs are and, all these different terminologies that can just confuse a person. So I really appreciate that in your presentation. Can you go back to the basic terminologies, just talking about that? That's your second slide.
Okay.
Yeah. So a caregiver is a person who is providing care to a person, right? Mm-hmm. A person in the comfort of their home. And you said it could be a professional.
Yes.
Or it could be family or friend.
Yes.
Is there a point where a family or a friend becomes a caregiver and goes into the realm of caregiver and not just stay as being a family or friend? Does that make sense? At what point,
I understand what you're trying. You end up having both roles. You do end up having both roles because you start to look at things from family, especially when the person is older. You start to look at it as family. Oh, this is my mom. I'm taking care of her. But most of the time, people who become family members, who become caregivers, don't see themselves as caregivers until an outside person tells them, oh, you have become this person's caregiver because you're helping them with this. We're helping them with showering. You're making them meals. You're helping them. You're providing physical assistance to them as they're walking. So it's usually a third party that reminds the person, you're not only family, you're also a caregiver by doing all these things that you've been doing with them for this long.
Mm-hmm. Mm-hmm. Okay. Yeah, I agree with that. Yeah. And at what point, when an older adult, when they are aging in place, at what point do you find they can no longer safely age in place?
So usually it's when things that if they start to have some memory issues, like short-term memory, you're cooking, you forget you left something on the stove, or there's increased falls, or you notice they're unable to manage their medications properly, because you start seeing that decline as time passes by. Usually if you see them often enough, within a month, sometimes you can notice that drop from their I usually like to say baseline, from their baseline till you see that drop. Okay, they're not dressed appropriately for the weather. They're not taking their medications at the time they're supposed to. They're not sure which medications they're supposed to be taking. So when things like that start to happen, And if you still want them to continue to live at home, it's good to have help come in to help with those things, especially at specific times, and try to keep their schedule. Like if it's someone who likes to take a shower in the afternoon because it's easier, it's warmer in the afternoon rather than taking a shower in the morning, have someone coming during that time, keeping their schedule instead of forming things around your schedule, form it around what they're used to. So it's not confusing or jarring to them.
Yeah. Very good point. Very good point. I loved how you shared with us that there are different ways to work with your budget. That is just so brilliant because, it's a way of like sharing resources, using the community in a way that's going to, it creates like a win-win, especially if a person lives near a college campus, right? They just need to make sure that they have good background checks on the people.
Definitely.
But if it can be a win-win for the student and also the person living in their home, wow, that's really powerful. And even sharing, you mentioned sharing a caregiver, right?
Yeah, absolutely. Yeah. You can, if you have a neighbor who's also around your age or someone who's younger, who's willing to come in and check in on you. We have neighbors who will come in and just, okay, meal times, let me bring you breakfast. I'll bring you lunch. I'll bring you dinner, just checking in. That way that person gets to stay in their own home while the neighbor gets to know that, okay, my neighbor's doing okay. I've known this person for a certain amount of time and I know they don't want to move into a facility. And I'm just being there to be able to help them to continue to live in their home comfortably. That's a very great thing to do for somebody, regardless if they're family or not.
Yeah, that's awesome. I just want to, let's see, I jotted down some questions for you, but as you were talking, it's like, oh my gosh, it's just so much juicy information. The slide where you had aging in place are several reasons for wanting to age in place.
I'm sorry, could you say that again?
So the slide after this one.
Okay.
Oh, that one. Yeah. So comfort, definitely comfort. It reminded me, I invited a guest speaker about a year and a half ago. They talked about their company. Basically, they go into people's homes and they put stair lifts and they do ramps and they do a home assessment to make sure that it's a safe environment for an older person to age in place. And in that conversation, they were talking about how, a home that somebody bought when they were in their 20s or 30s, before they started their family, how, a two-story home, how it's like a beautiful home because you have two levels. But as you stay in that home and you age in that home, it becomes more of like a dangerous situation, especially when you have stairs, very steep stairs going to the second floor, and all your bedrooms and their bathrooms are on the second floor, and you only have your living area on the first floor. Then you have another steep set of stairs to go down to the basement. How the perspective changes. All right. So considering all those factors can help a person, hopefully the older person, determine, is that really a safe place for them to stay in? And if they still want to stay there to age in place, there are different resources, different organizations that can make sure that the person can stay there as safe as possible. And that could be adding ramps or maybe installing a bathroom and having a home healthcare come in. So you really creating a lot of systems in place just to make sure that the person is safe in their own home.
Oh yeah, absolutely. We go to this meeting. And we meet people with local businesses just providing senior services. That's the whole group. So I met this lady, and what she does is just like you said, she will come into the home and they'll help people move everything to the same floor, even though it's a 2-story building. So that way they configure the house to the point where you don't have to keep going up and down the stairs. if you are going up and down the stairs, it's once daily because they put everything on the same floor, move the bedroom down to the first floor so you don't have to keep doing the back and forth, which makes it so much safer for you. And you don't have to leave your home.
Right, right.
So there's so many services out there for you to that makes things easier for you to continue to be in your home.
That's great. Wonderful. Now, if I could ask you just to come off the screen share, just so people can see us talking. And if there's anybody on that has any questions, please unmute yourself. And it looks like your colleagues has put in links where they could have, when people can download notes from this program. So that's great. Thank you so much for doing that.
Absolutely.
Yeah. So again, if there's anybody on the program right now, if you have any questions, please unmute yourself or type it in the chat and I could read it and Lee can answer it for us. Lee, I know that you were talking about the focus is right now how older adults can age in place.
Mm-hmm.
How about people who are younger than 60 or 65?
Mm-hmm.
Do they also have any type of resources that can help them safely live at home?
Usually, as far as there's a need available, most of the time, those services can't translate as well. Just because you need help with those ADLs and those IADLs, the insurance would cover those things as far as there's a doctor's order that's showing that this person is in need of these services, they have to cover it.
Mm-hmm. Okay.
Most of the time, they do have to cover it. It might take some work, having to work with a case manager to get things going, but they do have to cover those services because that's what you have the insurance for. So they have to provide those services. Like we work with we work with a lot of people that are younger and need like a walker or shower chair, grab bars in their bathroom. The insurance has to provide those things. That's why you have them, really, you know.
Mm. Now, let me ask you, what do nurses like you, what is your role? What is your role in helping people age in place? What do you do? Do you go to people's homes and you evaluate their home situation, or do they contact you and determine what type of resources they can get?
Mm-hmm.
What do nurses in your role do?
So for me, we have certain services. Most of the services that I listed were able to provide them. So let's say I'll start from the beginning. You give us a call. Oh, I've been taking care of my dad. Then we go through these questions. Are you providing physical assistance? Are you providing supervision? Things like that. So we ask those questions initially before we go in, and we try to look for services that we can get covered for you. Then we go into the home and do the assessment. Does this person have their own room? Do they have, what kind of assistance do they actually need? Because sometimes people say, oh, I'm providing someone tells you I'm providing supervision, but then you go into the home and you see them holding the person like, oh no, it's just sometimes, maybe once a week, he might need some help because he's a little unsteady. And I try to explain that is physical assistance. Even if he needs it once or several times during the day, you are still providing that assistance. So sometimes you have to explain to people yes, it might be once, it might be multiple times. It is still a different level of assistance that the person needs. So what we try to do is we make sure that we do an intake before we go into the home. And then when we do go into the home, we make sure we assess the house to make sure it's a qualified setting for that person to live in. And if it's not, we try to provide options. Provide options like, some equipment you can get. And we work with several companies that would come in, provide you with a shower chair, help you install those grab bars and things like that to make sure that home is a qualified setting. It's a qualified setting for that person to continue to live in. That's what we do, really. And then based on the assessment that we do in the home, okay, this might be what you need. You might need a home health aide, you might need a CNA, you might need a registered nurse, or your family member can continue to take care of you because you don't need skilled nursing care right now. So we have different programs to just make sure that we're able to provide assistance as needed, really.
Now, if somebody, let's say, if they needed housekeeping, somebody to help clean the house, or if they have visual problems, they can't drive any longer. Is there a way for them to get some sort of assistance for housekeeping, maybe grocery shopping, ride situations?
Yes, there is. So based on different insurances have different coverages. And what we try to do is make sure we look up their mass health number and we can see, okay, what can we get covered for this person? And most of the time, if they're unable to drive, you can get them non-emergency transportation to appointments and things like that, or have a homemaker come in a couple of times a week to just clean and get things set up that would make it as comfortable for them to continue to be in their home.
Wow. So it sounds like you really your role needs to really know all the resources available in the community to make sure that your client gets the most that they can get to live as safe as possible, to be able to feed themselves, and to be able to get back and forth to appointments.
Yeah, absolutely. And we try to like work with companies around us as well. So if we can provide those services, we refer you to people who can provide those services. Just because, we all have to work together. I don't see it as a competition. It's a community of people trying to like work together to provide services the best way we can for the people we work with. So if we can provide certain services, we make sure we refer them to people who can. But most of the time, we're able to help anybody who comes to us to kind of just make it easier for them in their own home. I love being able to provide those services. And like when you speak to someone, they come in worried, and you see that smile on their face after the phone call, or you can hear it in their voice, or the relief in their voice. It's everything to me, really. I absolutely love that feeling.
Yeah. Oh my gosh. Oh yeah. That's great. It just makes you feel like you're doing your job and serving the people that you want to serve. I totally get that. One of your slides had to do with asking for help. And just, taking care of many different types of patients through my nursing career. I know there are some people who are hesitant to ask for help. There are people who don't even know that they need help because they've compensated for so long. They might have fallen a lot, but they say, nope, I'm not a fall risk. Or maybe they are losing weight, or maybe their blood sugar is going up because they're not able to get to the grocery store, or maybe they can only get to the nearest convenience store and get, donuts or whatever. Nope, they're fine. They're healthy, so it's just they compensate. And so I can imagine your role, how important it is to initially do a lot of education, to bring awareness to what's available and what you do, and the impact of, your work on their quality of life. It's
really, initially, I know that slide wasn't there when I sent it to you. So I added this, I think it was last night I added it because I just started thinking about it, because even us as, finding that just getting to that point where you do everything independently, you do everything by yourself. You don't need to ask anybody for help because you're used to doing certain things. As you get older, those thoughts and those feelings don't go away, because you feel like, I should still be able to do this. I should still be able to do this. And when you start realizing, oh my God, my body is betraying me. Like, I can't pick this up without tremors. I can't get up on my own without holding on to something. It takes some people longer for them to realize I need to ask for help. And that's why I added that slide. Asking for help is it's so simple and so obvious, but it's very difficult for a lot of people. And most of the times those things will lead to depression, because you're feeling like my body is betraying me. That realization that I can't do all those things that I used to do. And sometimes there's denial of, no, I can still do these things. I might fall, but I will still do it. I can still get up and go to the kitchen and cook that meal by myself. But you know, in the back of your mind that you're not supposed to be doing these things, but it takes longer for some people to get there. And that's why it's good to have people around you. When you have a community around you, they will help you get to that point of like, okay, you need help. Let me help you. Or just sometimes it's easier for someone to offer the help than people asking for the help, because they're like, okay, I didn't ask, they offered, because it makes it easier to accept that help in that moment.
Mm-hmm. Yeah.
So asking for help is a really big thing in a lot of communities, and just people feeling like their body is betraying them and not being able to do all the things that they used to do before, really.
Yeah. I mean, I think we could even have a whole program on how to ask for help.
Yep.
Because again, people might be shy to ask, or maybe they don't want to be said no to and be disappointed. Maybe they have so much pride that they feel like, no,
That's a big one.
Yeah. So, finding different ways to kind of ask for help without feeling like you're really being dependent on that person is a nice way. What can you think of, like one or two type of ways people can ask for help without feeling badly that they're asking for help? What are some ways? Some
of the ways, because I'll say one thing before I say a few ways, is sometimes it can be cultural. Being a Nigerian myself, I know this. Like, it takes a lot, even for me as a young person, that I might not, I need help with certain things. And I'm just like, oh, I think I can figure this out. When I know, like, rationally, I should ask for help for someone to help me figure this out. So when you get to that point where you feel like, okay, I need to ask for help, but I don't know how to ask for help. One thing is trying to ask some help for people you feel safe. They're not going to turn you down, or they're not going to look at you a certain way. That's one good place to start. Just asking for help for people you feel safe around. Because some people asking for help from the wrong person could lead you into even a downward spiral. Because you're young, you're 65, you should be able to do this by yourself. And they don't know your body, you know your body. So sometimes people make it hard for you to ask them for help. So it's easier to ask for help from someone you feel safe around, or making it like a statement rather than a question makes it easier. Because with a statement, you're not expecting an answer. But with a question, you're expecting a yes or a no, or a maybe, or I can't right now. So phrasing it as a statement can be an option.
Yeah.
And sometimes asking a stranger for help is easier than asking someone you know. So picking up the phone, just like going on the computer, home care agencies or services near me, talking to a stranger on the phone is easier than talking to your family sometimes. And that I have found almost every day, picking up the phone, talking to people, because then they start revealing things to you that they haven't even told their family yet. So asking for help from a stranger or just phrasing it as a statement can be a starting point sometimes.
Yeah, I love that. Very nicely put. I mean, also, I guess, not taking it personally when somebody says no. Because, what's important for that person may not be important for the other, may not be a priority for the other person. So maybe just giving them that space. When you ask the question, can you go to the grocery store for me? I'm out of eggs. Maybe just asking or saying, hey, I'm running out of eggs at some point this week or next week, I'd appreciate it if you could, pick up a dozen eggs for me. I'll pay you as soon as, when
people are worried about feeling like a burden too, feel like, oh, now I have to call him, then he's going to have to change his whole day to stop by my place to drop off things for me. So that's one of the reasons people sometimes don't want to ask for help. But if this person is family, and sometimes we as family members need to look more into our older or families with disability to make sure, okay, am I being open enough for this person to be able to ask me for help? Or am I making myself available for them to feel comfortable around me enough to ask me for certain things? Because sometimes we don't know how to help. So we make it impossible for people to ask us for help, which turns into a whole cycle.
Yes, yes. And then we could also think about the other spectrum when people keep asking for help.
And then you start avoiding them because you know when you see them, they're going to ask you for help.
Oh no. Yeah. So, what's important for people in that situation who want to be helpful, but know that they're going to be sucked in to do like a whole list of things to do. What would you recommend for caregivers?
Setting boundaries. You have to set boundaries. You set boundaries so there's enough space for you to provide help, but not to feel overwhelmed. Because one of the things that happens with a lot of caregivers is caregiver burnout. Especially if you live with the person, you're there all the time and you just feel like, oh my God, I need a break from this person today, which is okay. It's okay to need a break from providing care. Just make sure that time you're taking a break, make sure there's someone else who's able to provide the care you're providing when you take a break. Because if you as a caregiver, you're there 24/7, 365 days a year, there's going to be burnout. You're going to get tired. But making sure that there's someone else who can take over from you when you're not there can be very helpful, because if you're down, then they're down too. So you have to make sure you take care of yourself while you're taking care of the person you're caring for as well, which is a big thing. Like a lot of caregivers don't know where to ask for help because they don't know they're burning out until the point when they start getting frustrated and they start having all this outbursts when it's just, oh, can you get me this? Can you get me that? They're just, oh my God, I can't believe you're making me do this again. You get to that point and you don't want to get to that point. You want to make sure that you create room and you set boundaries so you're able to take care of yourself and take care of them as well, without leading to the point where there's outbursts, so you're getting angry at them and you get resentful of them. So you want to make sure you set those boundaries.
Yeah, creating the boundaries without guilt is very important. Yep. Yeah,
definitely.
Yeah, guilt is so.
That's a whole nother topic.
That
is a whole nother topic.
Yes,
you feel guilty about not doing enough.
Yes.
Or you feel guilty about, you enabling people to not be able to care for themselves. It's a whole nother topic. Many. Yeah.
I hear that. Oh, definitely. Yes. Now, talking about caregivers, what type of, if a family member or a friend finds themselves in a situation where they're always there caring for that person that they care about, can they qualify for some sort of financial compensation? If so, yes. How do they do that?
Yes, that is where AFC comes in. Adult foster / family care. So if you're living with this person and you're providing care, you're providing supervision, providing physical assistance, if they have some insurance, you can get adult foster care in place. So adult foster care allows you to care for them, all the things you're already doing, while receiving a monthly stipend to do it. So depending on the level of care that you provide, you get paid more. If you're providing supervision, it could be level 1. But if you're providing physical assistance to that person with 1 or more ADLs, you could get approved for level 2. I know most of the time when you're providing care, you end up having to cut back on your work hours because you have to provide that supervision. And this can help compensate for the time you're cutting off work. So it's different adult foster care agencies pay differently. So you kind of have to look around to make sure, okay, let me get the best that I can get while providing the care, and I always try to remind people, if you're trying to get adult foster care in place, you cannot have a PCA because under MassHealth, they're under the same umbrella.
Interesting.
Yep.
Yeah. Yeah. So would that be like, what is the hourly wage? Is that like minimum wage for people who fall under the
Mhm.
qualification?
So it's the way our agency, I'm going to use our agency as an example, just because like different agencies calculate it differently. For us, we don't calculate it. It's not hourly, it's a monthly stipend. So it's tax-free, so you get the specific amount. For level 1 in our agency, it's $700 a month. For level 2, it's $1,500. And some companies pay a lot less, but we just try to make sure that we are providing the best we can, because we know that you're having to cut back from work providing care for your loved one or your family member. So we try to make sure that you're getting the best you can from us, and it's tax-free, so you don't have to report it. It's not necessarily considered an income.
Yeah. And how many hours a month would a person have to, how much work or caregiving hours does a person need to dedicate in order to get to that level 2 income?
So for level 2, you have to provide physical assistance with 2 or more activities of daily living, like with walking, with showering, having to like help them get dressed and things like that. So it's not specifically hourly. It's just like you doing your day-to-day of helping them. And then at the end of the month, you get a stipend. So it doesn't change. It's just every month you get the same amount. For most of the time, these are things that you're already doing before we come into the home. But when we come into the home, we provide you training with every visit. When we come into the home, you get a registered nurse that you can contact at any time. You get a case manager as well. And what our case manager does is try to like get them into adult day health, like get them involved in the community. So that way you get some time to yourself during the day, and they also get to like get involved in the community as well.
So it's really it's wonderful. I think it's really wonderful to be able to acknowledge the caregivers who are, integral in the health and safety of these people who need it. I love that. And I didn't know that different adult foster, what do you call it? Adult foster
care agencies.
Yeah, I didn't know that they had different range of salary.
Because each agency gets to set their own stipends. So it varies really. So you really have to call around and make sure, okay, is this agency gonna work for me, culturally speaking? Because these people, we're gonna be coming into your home every month. So you have to make sure you merge well with the persons coming into your home. So it's a lot of factors that goes into trying to pick the right agency for you and your family. Mm-hmm. So, and you also have to consider the rates as well going into it.
So I'm just still trying to understand the whole concept of what agencies like Rivers of Hope do. So if somebody needed help, they would contact an agency like Rivers of Hope. And would that person pay out of pocket for all the help, or would the insurance cover that? And would all insurance be accepted? And at what point do your assistants taper off? And another part of the question is, what areas of Massachusetts do you cover?
Okay. So those are a lot.
I know.
Those are a lot of
It just kept screaming. I couldn't stop asking.
I would start from, we don't take money from people going into your home, except they want private pay home care option. We do private pay, but most of our services is covered by insurance. So if you come to us and we do an intake and we ask for how you're providing care, what's going on in the home, and things like that. So we can figure out, okay, what kind of services do you need? So that's the first step. What kind of services do you need? If you're someone who's you don't need any skilled nursing, So we would suggest adult foster care, and then we go into the home and then we look around. Okay, you might need other things, like, let's say you might need companionship if you are not going to adult day health. And if your insurance is able to cover that, we will provide that for you. So we kind of go into it like person by person. We try to look at you, look at your family, and kind of figure out, okay, what's going to work for this person. So we create individual plans.
Okay, stop right there. Let me ask you this. Just because, working as a bedside nurse at Tufts for many years, when one of my patients need to go home with home health aide, visiting nurse, we need a doctor's order in order for that to occur. Now, does a person need their primary care doctor's order in order for your services to kick in?
Absolutely.
Oh,
because we work with the doctor's office as well, just because we're trying to make sure that we're updated, because sometimes people don't give you all the information. So when we contact the doctor's office, they send us a physical. We get a yearly physical to make sure we have the entire picture of what's going on. And we also contact the doctor's office. We do 6 months review. We make sure we do a semi-annual. We send it to the doctor's office to have them sign it, to look over it. And if there's something that we're missing, they add to it as well, just to make sure that we are all working together to provide the best possible care to the person we're caring for.
Okay, so the request doesn't have to occur from the primary care physician. It could occur from the patient or the family noticing that they do need help, and maybe them contacting the primary care doctor to get the order, and then initiating some sort of a contact with organizations like Rivers of Hope. Is that correct?
Yeah, absolutely. And it could be the other way. They could contact us first or contact their doctors first. Like, we would walk them through the process. I tell people, we get as involved as you want us to be.
Nice.
So we walk you through the process. So we'll contact the doctor's office. Anyone can send referrals. And we try to work with you through the entire process, because this is something that you don't know. And this is what we do. So we try to provide you with as much information and help you through the process as much as you will let us, really.
Okay, wonderful. And at what point does the care start tapering off? Once the care and the services have been initiated, at what point will the person not qualify anymore? Or there's a change in the client's medical status or mental, psychological status? At what point is there a shift?
Okay, so we have annual assessments.
Okay.
So last year we do an MDS. It's a minimum data assessment. So we do an MDS and we talk about the assistance that's needed. So after that, we go through the whole year, unless we notice as we go into the home that, okay, this person is needing less help. So then we might, during the year, do another MDS, do another assessment to make sure that the person is receiving the level of care that is needed. If they need more help, if they started off as a level 1 and they only needed supervision, and as the year goes along, we notice, oh, okay, this person is needing more physical assistance, we would do another assessment and send it to Mass Health or whatever insurance that they're working with to tell them, okay, this person needed less help in the beginning of the year, now they're needing more help. Or it could be the other way around. They needed more help now and they don't need as much help anymore.
Okay.
So it's a continuous assessment as we go into the home on a monthly basis, making sure that they're getting as much help as they need.
And it's the nurse that does the evaluation. Right?
Yes.
Yeah. Okay. So we've got a 2 to 3 minutes left of the program. As usual, the program flew by. So much great information. Lee, can you give us, what are 1 or 2 key takeaways that you want the viewers to learn about aging in place and the resources available for them?
I feel like the one thing I know I've mentioned it several times is asking for help. That's the first step, asking for help, knowing when to ask for help, and just reaching out to people if you're not sure what kind of services that you need, and then talking to your insurance to kind of figure out if you don't know what is accessible to you, talking to your insurance to someone who knows about your insurance policy to figure out what you can get in your own home, or contacting agencies like ours that can figure out what services we can get you through your insurance. Just asking for help and knowing what you can get through your insurance, because that's the biggest thing, because a lot of people don't know what they can get, so they end up with nothing. Would rather you end up with getting too much rather than less than what you need, you know? So it's just asking for help and figuring out what is needed in the home, how we can make it more comfortable for you to continue to live in your home in your own comfort, really.
Yeah, that's very big. Asking for help. I mean, even if a person is too shy or they're too embarrassed or have too much pride to ask for help, but
there's nothing to be embarrassed about.
I know, but it's just, some people, like you mentioned, it's cultural too,
Yeah.
So are there some people just don't like to ask for help because
they feel like they're putting their business out there.
Yeah.
And it's really not that way, because we cannot share anything you tell us without your permission.
Yes. Yeah. And that's why a third party is a better way for those type of people to be able to ask for help, because they know that, organizations like yourself depend on the request for help in order for your systems to really kick in.
Yeah.
Yeah, very important. Very important. Well, I really want to thank you so much, Lee, for, spending the time to talk about, services available. I know there's just so many out there, and thank goodness for organizations like Rivers of Hope and, people, nurses like yourself, who constantly remain in the know, because I'm sure there's so many different resources available every year.
Oh, yeah.
Guidelines are changing, insurances are changing. You have to really stay on top of things in order to do what you can do for the people you serve.
Absolutely.
I want to thank you for coming on the program. And again, I want to thank the Quincy Health Department for continuing to, sponsor this program, and also QATV for continuing to share this program out in the community. So thank you, everybody. This is Debbie Lynn Toomey, Injury Prevention Coordinator from Tufts Medical Center.